The fourth heart sound occurs in late diastole, shortly before the first heart sound, as shown by the phonocardiogram. Listen to a patient with a fourth heart sound. I will begin with 3 normal beats and then add the fourth heart sound. The fourth heart sound is heard at the cardiac apex with the patient in the left lateral position. A fourth heart sound indicates that a ventricle is stiff and non-compliant. A fourth heart sound may be palpable at the apex. A fourth heart sound feels like a double impulse at the cardiac apex. When a fourth heart sound is added to a normal first and second heart sound, a triple rhythm is created. Although a fourth heart sound is due to a forceful atrial contraction, it actually originates in the ventricular wall. The most common cause of a fourth heart sound is hypertension. Poorly controlled hypertension leads to left ventricular hypertrophy in many patients. In summary, a fourth heart sound is a low-pitched, late, diastolic sound heard best at the cardiac apex.